We're in primary care clinic and a patient comes in endorsing that her mood changes 1 week prior to her period every single month. It seems to be cyclic. At this point, her husband is a little bit scared of her. How do we approach this and what are your thoughts?
Honestly fair. You want to parse out, is this normal PMS or is it what we call PMDD, which is Premenstrual Dysphoric Disorder? Now they're going to look very similar in terms of the timeline. So a week before her period typically gets better when her period starts, and then the week after. PMDD is going to have much more severe symptoms. More emotional ability, worse depression, you can have changes in appetite, energy levels, be more sensitive, more irritable. Also very common to have physical symptoms like breast pain or joint stiffness, back pain. You typically start with an SSRI. The best way to do this in terms of side effects is to do what we call luteal phase dosing if it's PMDD. If it's PMS, don't do this. But if you find that it's PMDD and she has a significant change in functioning, which is kind of how you distinguish them. So if she can't go to work, she can't go to school, she can't take care of her kids, her relationship with her husband is really suffering, then it might be PMDD and you might want to treat it. So start with an SSRI. We like Prozac because it lasts a long time, so it doesn't cause as many withdrawal symptoms when you come off of it. And you start it in the luteal phase, so that's 1 to 2 weeks before her period starts. And then she doesn't need to take it during her period in the 1 to 2 weeks after.
Yeah, I think it's really interesting that you can just spot dose Prozac. Usually we do like 4 to 6 weeks before the effects kind of take place, but for PMDD specifically, studies have shown that it works when you use it in that way. Another thing that you can do to help your primary care doctor as well as your psychiatrist is to keep a journal of your symptoms with a timeline. That can be really helpful.
And if you don't respond to luteal phase SSRI dosing, you can either take the SSRI every day and see if that helps, so just take it continuously, or you can try OCPs.
I had no idea about the spot dosing for Prozac and the luteal phase.
Yeah.
What dose do I use?
I start with 10 when I'm doing Prozac. It's just enough. Sometimes I have to go up to 20, but you don't need those high doses like when you're treating depression. Just
and then when her period starts, then she can stop it. And do I need to titrate her down from 20 to 10? No, she can just stop it. The half-life is so long. It's 72 hours, so it's like a gentle down.
Yeah, exactly. It's such a long half-life that she doesn't really get withdrawal symptoms. It just gradually kind of decreases over a couple of days. If she does have really bad withdrawal symptoms, then just have her take it every day. Don't do the luteal phase. Just take it all the time.
I love this. Thank you so much.
Mm-hmm.